Now 12.7 is the last subtopic in this chapter, that is the health issues which is related to human endocrine system, because previously we have mentioned about the effect of hormone imbalance, and that is this. So are you familiar with diabetes mellitus? A diabetes mellitus patient is the one that does not produce enough insulin, or they cannot use the insulin that is being produced. So the effect is that the level of glucose in the blood is always high, and that is dangerous. So this will cause the patient having this kind of symptoms, which they will urinate very frequent, going toilet very frequently. They are always thirsty and experience numbness in the sole of feet, blurred vision, tired, and their wounds heal much slower. Okay, and that is because not enough insulin is being produced. But the opposite happens. That means when there is excessive secretion of insulin, this condition is known as hypoglycemia. So that means the patient is always having a very low blood glucose level. And this is also dangerous because it seems like they are not having enough meal. So the symptoms, among the symptoms are that they always feel very tired, fatigue is tired, excessive tiredness, difficulty sleeping at night, even disordered thoughts, fear, emotional instability, faints easily, headache. So you notice these are the symptoms when you are hungry, when you are not having enough glucose in the blood. Okay, and that is related to the pancreas and the insulin hormone. Okay, how about diabetes insipidus? Diabetes has got two types. So kencing manis is diabetes mellitus, and diabetes insipidus is different. It is totally different. This is because the posterior lobe of the pituitary gland fails to secrete the antidiuretic hormone, and that is the ADH. So do you still remember? Maybe you have to look back at the function of this ADH. So patient having lack of this ADH, what will happen is that water fail to be reabsorbed in the kidney tubule. So this results in the patient producing large amount of urine, and they often feel very thirsty because they're excreting too much water. So since a large amount of water is lost through the urine, so the individual will experience dehydration if they don't have enough water every day. So two different conditions, but it is also diabetes, two different types. Okay, one is related to insulin hormone. Okay, that is secreted by the pancreas as the gland, and another one is related to ADH, or the antidiuretic hormone, and it is related to the pituitary glands, the posterior lobe. Now, this is another condition caused by, it is known as hypothyroidism. Hypothyroidism. So that means not enough thyroxine hormone secretion. So these are the symptoms where it will include extremely slow heartbeat. So that means, again, you might need to look back at the function of thyroxine. So it functions in controlling regulating the metabolism of the body. So now this patient is having very low metabolic rate. So he is having slow heartbeat, extremely sensitive to cold, tightness, and he will gain weight easily because of the low metabolic rate. So these are the features on the face that you can see on a hypothyroidism patient: dry and rough or sparse hair, thin eyebrows, even edema at the eye pocket over here, bloated, dry skin. Okay, this is opposite to hypothyroidism. This is hyperthyroidism. That means a situation whereby thyroxine hormone is too much. It is too excessive. That means this patient is metabolically reactive. So the symptoms are sweating, heat intolerance. This now was extremely sensitive to cold, and now he is heat intolerance. Increase the frequency of defecation, fear, heart always palpitate, and even weight loss because he or she is very active metabolically. So sometimes the thyroid gland will grow 2 or 3 times larger than its original size. Okay, there is excessive secretion of thyroxine hormone. This is hyperthyroidism. Okay, so this picture is showing the tallest man and the shortest man in the world. And this photograph is showing the hands of a 12-year-old boy with gigantism. So this is adult's hand, but this is the hands of a child with gigantism. Okay, what is gigantism? It is related to GH, and that is growth hormones. Excessive, too much during childhood, so it causes gigantism, characterized by abnormal elongation of bones. So that means the growth of the person's bone is extremely fast, high rate. So the person will grow to become extremely tall, and this is opposite to dwarfism, where GH hormone is under secretion. Under secretion, that means low secretion. Okay, and this will delay the growth of bones and causes condition known as dwarfism. So even the organs also fail to develop, and parts of the body ratio remains as that of a child. So now we have come to the end of the chapter. Okay, I've covered just now at this part, which is the endocrine system and the health issues related to endocrine system.